Thank you, everyone, for coming tonight for our discussion with the Doc series. Tonight we have Dr. James Connolly from the ER, Janine Fee, she's a vestibular therapist here at EVAN, and my name is Julie Charlton. I'm also a physical therapist here at EVAN. We're going to start with Dr. Connolly discussing the signs and symptoms of concussions, and then we'll start our presentation.
Sure. All right. Hi, I'm James Connolly. I'm one of the emergency room physicians here. First of all, I'm going to get up, talk, walk around. Wow, that's bright. Feel free, like small group. Any questions, just raise your hand, shout them out. Just shout, whatever you like. My only caution is to keep the questions of like, don't be super personal about yourself, like in your case, the emergency room. Keep them general, of interest to the room, maybe. So let's talk about concussions. Let's define kind of what they are, how they happen. So as everyone knows, like, concussions typically come from kind of hitting your head. And what we think causes concussions is not so much an impact, but a sudden deceleration of your brain tissue. So it's not necessarily, if you think, everyone talks about football when they talk about concussions. And it's not necessarily like the crushing hit, or like a crackback, or like the free safety comes flying in and takes down the running back. It's more commonly, I think, if you think of two offensive linemen repeatedly banging their head together, play after play after play, that sudden acceleration, deceleration. And people think, so what is the concussion? What is the actual mechanism that happens? You can think of it like a bruise to your brain. That's kind of one way to think of it. But when you think of a bruise, you think of bleeding, like a purple mark. That's not actually what happens in the brain. So when part of your brain is suddenly decelerated, it causes this inflammatory process. And so when you have inflammation in the brain, what we think is happening is that you actually have impaired glucose delivered to the brain. Glucose is sugar, and it's what your brain uses for fuel. So if you have a part of the brain that's not getting fuel, it's essentially running on a half tank, kind of sputtering along. If you imagine an engine that's about to run out of gas, it's just not working very well. So this part of the brain, let's say, it's responsible for balance, the part that's not getting sugar, not getting gas. You're going to have symptoms of impaired balance. How common is concussion? The Center for Disease estimates about 3.8 million cases a year in the United States. So it's common. That number is probably low. I think a lot of concussions go undocumented, unreported. That number is going up too. There is more awareness. The movies were just out about concussion. I know in the emergency room here, we're seeing a lot more concussion, I think, than I ever have before. So what are the symptoms of concussion? So let's just a quick question. Who's a coach? Anyone? Who's an athlete? Anybody else? Okay, good. So I think one of the tricks in concussion, maybe is part of the reason why you guys are here, is like, how do I know when one of my players has had a concussion? And that's tricky, because there's a lot of kind of competing motivations as well. Players don't necessarily want to admit they've had a concussion because they're going to be afraid that they've come out. We'll talk about some of the specific signs of a concussion in just one second, but just as kind of the take-home message from my stand would be, if there's any symptoms at all, you've probably had a concussion. And the tricky thing, not necessarily the dangerous thing, but what really makes it hard is often the symptoms of concussion won't show up to a day or two later. They may actually go down, have a big impact and feel perfectly fine, have absolutely no complaint, but yet they still sustained a concussion. So it's going to be tricky. You're not going to get it perfect. We're not going to get it perfect. No one's going to get it perfect. It's a tough thing to diagnose, especially when they're not having any symptoms. So when people do have symptoms, especially when they come to the emergency room, that's when I see them most. What they're kind of tending to complain of is feeling dizzy. Just their balance is not quite right. They're kind of walking funny. Maybe like they've accidentally walked into a wall when they didn't mean it. Someone might be having nausea, occasionally vomiting. Difficulty thinking, like they might be a student and where they're having a really easy time doing calculus, advanced AP classes. All of a sudden, these are really tough to do, and they just can't concentrate. They feel like they walked out of the class and like, I don't know what we just did for the last hour. These type of symptoms are all common. Anything, really, just imagine any part of the brain that does any sort of function, and you impair that, it can result in a symptom of concussion. Let's see, what else should we talk about here? So, when to come to the emergency room, and what are we looking for in the emergency room? Parents usually bring their kids in because they're vomiting, they're maybe sleeping more than normal, they're just not acting right. That's probably the number one thing. My child is just not acting right. And what I'm looking for are not necessarily signs of concussion, but signs of serious traumatic brain injury. In the short term, concussion is not necessarily dangerous. It's not necessarily a life-threatening process. When it does become dangerous, or when it does become immediately life-threatening, is when it's beyond concussion, when you actually do have that bleeding in the brain. So what I'm looking for are signs of bleeding in your brain. And they often mimic signs of stroke. So if you were to see these symptoms at any point, I would say yes, absolutely come to the emergency room. And some of those symptoms would be prolonged vomiting, not just vomit once or twice, but for an hour straight they're vomiting. They're having slurred speech. Not so much hazy vision, but they're having true double vision. Like I see, looking at a clock, I see one here and I see one up here. That's a little bit more concerning. One arm just isn't working quite right. True changes in speech, like slurred speech. They can't talk at all. Just big changes from their baseline. And what do we do when we see these things in the emergency room? What we typically do is a CAT scan. Often we do CAT scans without these symptoms, and just don't tell anyone. But secretly, we're treating the parents with most of these CAT scans, and not the children. We're giving reassurance that there's no serious brain injuries. I don't think just reassurance here, not once have I scanned someone for concussion actually seen anything on a CAT scan that changes what we do. I tried doing a little lit search just now back at home, seeing how frequent that is, and I couldn't find the answer real quick. I'm sure it's out there, but I know that number is low. The number of scans we do for concussion and the actual number of findings is exceptionally low. When we do the scans and find things, you usually know you're going to find something ahead of time, just based on the exam alone. They have those stroke-like symptoms. That said, though, don't hesitate to come to the emergency room. We're here for you, just for reassurance, if nothing else. If you're worried, we're happy to evaluate your child, your player, yourself, and just kind of say, hey, this is okay, this is concussion, you're going to be okay. You'll wake up tomorrow, I promise. And also, that's just while we're talking about that, it's okay if your kid wants to sleep. You do not have to wake your kid up every 2 hours in the middle of the night. Sleeping is great. That's one of the best ways to heal a concussion, resting the brain. So let's talk about treatment. Back when I was a resident about 5 years ago, we did rotations in the pediatric hospital, and we'd see concussions all the time. Sometimes it felt like every fifth patient. And what they used to advocate back then was called cognitive rest. And essentially what that meant was staring at the wall. You didn't want to think too hard, you didn't want to watch television, you didn't want them reading a book, complete brain rest, essentially watching paint dry. But when thankfully they've studied that and done kind of comparison studies, and that treatment does no better than just kind of taking it easy. So that's what we advocate, just take it easy. You can go to school, but don't study hard for a test. If you have finals, we'd advise you not to take them. If you have to do this huge memorization, for like a vocabulary test, we have to learn lines for a play. Anything that's going to stress your cognitive resources, we advise you to avoid until you're asymptomatic. That's really all you need to do for concussion. Just be vigilant, watch for some of those dangerous signs that we talked about, take it easy, and just gradual return to your normal activities. Let's talk about sports returning back to when are you safe to go back to sports? And how we advise this from the emergency room is kind of essentially one step at a time. So you have a concussion on day 1. You're pretty symptomatic. You come to the emergency room on day 2. You're having some nausea. Your balance feels a little bit off. We evaluate you. We say you're safe to go home. What we're going to tell you to do is don't go back to sports until you're 100% symptom-free. If you're still feeling unwell, you're still suffering the signs of concussion, don't go back to sports. And we say that because the most detrimental thing, the worst thing that can happen, is that you get a second concussion while you're still having symptoms of the first. More so than anything else, a repeat concussion has been shown to have long-term effects. People have multiple concussions, but when they're spaced out over a period of time, they're less likely to cause long-term cognitive impairment than repeated, stacked trauma is what we'll say, just, within a week, let's say, basically when you're having symptoms. So let's say you're day 2, you're a little bit nauseous. Day 3, that nausea is kind of going away. You're a little fuzzy. Day 3, you feel okay. You're back to your normal self. So what we say is graduated return. So that first day, you go for a walk. If the team's practicing basketball, just walk around the court for a while, be at practice. Maybe stand at the free throw line, shoot some free throws. Day 2, just take a jog around the court a little bit. You can do the walkthroughs and that sort of thing. Day 3, you can start, going a little bit harder. Day 4, day 5, if you keep elevating your activity, you keep remaining symptom-free. If you get all the way back and you're asymptomatic, good, you're done, concussion's over. Most people are better. About 90% of people are better within a week. 5 to 7 days is what we say. However, there's a small number of people that continue to have prolonged symptoms. And that's kind of where we get into, post-concussive syndrome. It's this prolonged nausea. And it's really not even the nausea so much as impaired cognitive ability sometimes. People just say, I'm not my normal self. I can't think straight. I can't, doing the normal tasks that I used to do has just become increasingly difficult. And so when you get to that point is where, we turn you over from an emergency room standpoint to kind of more the physical therapy side of things. And then these kind of, which you guys will talk about here briefly, and kind of what to do in a long-term type setting. So we'll talk also about this test called the SCAT-3. So as a coach, as a parent, when you're concerned that a concussion may have happened, what can you actually do to evaluate your player? Do you guys want to talk about the SCAT-3 at this point, maybe, just as a way? Sure.
The SCAT-3 is the Sports Concussion Assessment Tool. There's part that coach or athletic trainer, if there's an athletic trainer at the school, can do on the sideline. That's the sideline assessment. Talks about the symptoms that they're having at that point in time. You also do the Glasgow Coma Scale. Then it gets into a little bit more of a background, cognitive physical evaluation. You look at the neck, you look at a balance assessment, which is standing on one leg. Can you do that? Can you not? Coordination, as well as recall, numbers, and amnesia, any problems with memory. It's a baseline, or I'm sorry, you do it after the concussion. What's really nice and what we like to see is that you have the SCAT done before the concussion occurs. If we have the baseline because perhaps someone's balance isn't the greatest before they have the concussion, and here we are testing it and we're looking at them thinking they're impaired. Same thing if they have memory issues. Some kids have ADHD. They're not going to perform as well on this test prior to the concussion. So then, boom, they have a concussion and they look really impaired. So it's nice that we're trying to get this baseline done before any concussion occurs so that we can compare it from post-concussion to pre-concussion. There's a graded scale. We can look at it, do it over weeks after the concussion, see if there's any improvement.
There's a SCAT for ages 5 through 12 also. So if you're a middle school coach, there is a SCAT that you can do to your kids if a concussion would occur or something would come up that you could do yourself as a coach. And then there's the SCAT for the kids over the age of 12.
It's very similar to like the impact testing that you're hearing of the high schoolers doing prior to any of the sports. And again, that's your baseline. What the impact test does more is your cognitive abilities before you go into practice. Lots of the football players and any contact sports, high school will do that. Problem is a lot of concussions can happen to those middle schoolers that are playing team sports and traveling sports, and they're not getting that baseline test. Another, what the impact test looks at is your cognition, recall, memory, and reaction time. It's on a computer. What many high schools do with the athletic trainers is they bring the whole team in, they're in a computer lab, they take 20 kids, they do the impact testing, they leave, the next 20 come in. Again, it's nice because you have that baseline. It's nice to have in conjunction with other baseline testing such as the SCAT. Some downfalls of it is you're in a big group of people, can be noisy in the computer lab, so you might not do the greatest. They also say kids can not perform well, so that if they do have a concussion, that it won't look so bad. However, it is hard on the computer to really screw that up and fake it without looking really bad. But that's something that the high schoolers do before the season that they can get the baseline.
So are you looking at reducing that to middle school then?
The impact testing, there is a lower middle school grade. However, it's not approved in the United States. So that's when we start looking at other avenues that we can do for middle schoolers because there is no research doing the impact testing on the middle school kids.
So we're going to talk about that and what we're going to do here at EVAN to sort of hone in on those kiddos as well. Do you want me to keep going?
Do you think, I'm thinking about it in terms of as a parent, especially when you're talking about the middle school kids don't really have trainers. How hard would it be for, say, one parent on the team to learn how to do the SCAT-3 and be like, yes, I will be the SCAT-3 aficionado for our season? Do you think it's something the average person can learn?
Oh, yeah.
Yeah.
Yes. Mm-hmm. Yeah, it's pretty simple.
I do our church's board basketball and cheerleading, and in the past 2 years we've had a legit concussion both years. This year, thankfully, the coach of the team where it happened, he's also a soccer coach, and he was required to do the concussion training, so he was able to, go through everything with the parents, which then kind of gave us a baseline to go back to, because parents were not great about following up with a doctor visit. So it's like, okay, then he's not playing for 2 weeks, because then at least we know if it was, which we were pretty sure it was, he's at least had, some time
To heal.
recover. Yeah.
That's one of the great things that's happening now, because concussion is all over the internet, it's all over TV, the movies and so forth, that all the coaches, even the coaches of the middle school teams, are having the concussion education beforehand, so the parents can know also.
Dr. Connolly, you were talking earlier about glucose being supplied to the brain. Is there any studies being done to try to increase glucose to make the injury recover?
That's where the rehab process comes in, and so I can talk about that a little bit if you want me to. So I'll move on to my slides. So I'll start with the basic thought of, I thought a helmet was going to protect me from a concussion, and the helmet is really meant to protect you from like skull fractures. So Julie here made a beautiful little snow globe. So this is the glass representing the helmet, and we could wrap it and wrap it and wrap it to protect it. So if we drop it, bang, what will happen is all the contents inside still will shake around. So that's essentially your brain inside the skull. So you can't see what's happening to that brain inside the skull. So again, going to the emergency room, having the CAT scan done, it likely comes back normal, because what we're finding, as Dr. Connolly said, is the concussion affects the brain at that cellular level. So there's shifts, and there's these little transmissions called neurotransmitters that send signals from one area of the brain to the other. And because it's shifted and the glucose isn't able to get there fast enough, these symptoms that kids have are global. So not only do you have maybe concentration and memory problems, you also have some balance problems. And like Dr. Connolly said, after a few days, usually about 3 to 7 days, symptoms start to calm down to the point where a lot of children go back to their normal pre-onset level. Then there's a lot of kids who will then manifest into one category. I still have some issues with thinking, or I still have some issues with dizziness, or my balance isn't quite right. So, and that's where then the therapy process would maybe come into play.
I'm going to interrupt you here
Go ahead.
for a second. We have another person on our panel here, Dr. Olivero, who was busy with his practice here at EVAN. He's one of our EVAN physicians.
Sorry, I'm late.
And he was waiting for a phone call, so he's another person who's going to be given some information tonight.
Do you want me to keep going? Or do you want to?
Please.
Yeah, okay, all right. So to diagnose a concussion, it's very difficult. As Dr. Connolly said, there's really no definite tests at all to really look at why or who has a concussion. So we really have, the best way to figure all this out is really it's a combination of symptoms. So using scales like balance testing that we're going to talk about, that we're going to do for baseline testing, balance assessments, doing these scats to really get some cognitive things are really helpful to help determine if there's a concussion that has occurred. It's really a team approach. You really need the athlete to be reporting some symptoms, or other kids going to their coaches to say, hey, I think there's an issue. And then it's also then that coach going back to the physician, and the physician starting the ball rolling, or getting the process rolling of what does this kid need. So what we're advocating here at EVAN is more of this baseline screening. If we had some information on these kiddos prior to their season starting and a concussion would occur, then the doctor would have more pieces to their puzzle to be able to make that better decision as to when can this kid return back to play. Because right now, the kid could easily say, I feel fine. And the doctor may not have, a lot of testing to really affirmatively say, yes, this kid's ready to go back to play. And the reality is, you send them back in too early, as Dr. Connolly said, that second concussion now can cause those little neurotransmitters, those signals that were improving and they were repairing themselves, Now you're causing long-term consequences, or there's actual damage. And now you're going to have long-term consequences, which I think Dr. Olivero is going to talk a little bit about. So again, that's why we're advocating this baseline screening. So what are we doing? Part of our mission here at EVAN is to educate. So we're planning to go around to different schools to educate that, hey, this is a real thing and that we have these opportunities here. Because as I'll pick on you, Sylvia, as we know, it's very frustrating when you have something like a concussion happen and you are all alone in this process and nobody around you knows how to help you. And so you're constantly seeking for that next medical advice that because they're so global and these concussions are like snowflakes, there's no two that are the same, you keep getting tossed to the next person and it becomes very frustrating. So if we could work more as a team approach and have some sort of baseline, we'd be better able to help manage or at least help advise what would be the next step. And then certainly if you continue to have symptoms, and we're talking symptoms that continue to persist 2 to 3 weeks after the person has had a concussion, that's when physical therapy may be beneficial. And physical therapy has been shown that with some form of aerobic activity, you're increasing the endorphins. Now you're increasing that need for the blood flow to get to the brain, or that glucose. So exercise is what they're advocating now in a regimented way of getting back to play, like Dr. Connolly said, very slow progression. And there's a called a Zurich model that I can point out that I have up here that I can show you on that, how to return someone back to play. So our baseline screen, basically what we're doing is it's going to cost $25, and you can call our telephone number, I think is at the bottom here. You can call to make an appointment, and it takes about 15 minutes. We are going to be doing the SCAT test depending on your age, so that's part of the baseline screen. The $25, what that includes is we do all this baseline testing, which would include the SCAT test, balance. We also have found that many people who incur concussions will also go through a period of depression. So we're also looking at that component because with multiple concussions, suicide rate can also significantly increase. And so that's going to be one of those hot topics at some point in time in this area as well. So that $25 then includes if anything would happen to your son or daughter, if a concussion would occur, they have up until a year to be retested. So they can come back in for free. Basically, that's included in that $25 assessment. We do all our balance testing and all our SCAT testing again so that you can watch the progression of this kid. Are they making progress? So we sort of advocate if a concussion occurs that they should be seen by one of us within the next 3 to 5 days. And then after that, every 3 to 5 days, just to make sure that they continue to progress. If they're not progressing, we report back to the physician so that the physician knows what would be maybe the next step. And or we also report back to the physician to say, hey, they're making some nice progress, but they're not quite ready to be returning back to play. So the baseline screen includes what's called a Biodex test, which is going to be a balance assessment. I'm going to show you that here in a little bit, but we have the piece of equipment over here that we can demonstrate when we're all finished. It is a very objective measure for measuring someone's what's called postural sway or balance. So it's a way that kids can't fake, I'm okay. It really gives you some objective data to determine if their balance is back to normal to be able to go back in and play the lacrosse game or the football game. The neurocognitive assessment is the SCAT test that Julie had talked about, so looking at memory. We're also looking at a graded symptoms checklist. Many of these kids, like Julie said, have ADHD prior or they have migraine history. And so if you have a migraine history prior to a concussion, then if you have migraines after a concussion, maybe we wouldn't be thinking that had anything to do with a concussion. So, these are some things that need to be weeded out. And then we're also going to be doing what's called a PHQ-4, which really looks at that anxiety, depression component, because these kids in high school, athletes, lots of times athletics defines who they are. And when you're telling a kid that they can't go back into play, you're really starting to mess with their self-confidence. So we do want to get them back to play, but we need to get them back to play safely. This is the Biodex machine. This is me standing on the machine. It's called a clinical test of sensory integration and balance. It looks at 4 conditions. You're standing on this board that's solid with your eyes open, and it measures how much someone's swaying. Everybody has a normal reference, and what we do is it also then has normative data, but it also then compares you to you. So it will look with your eyes open, then you close your eyes because your balance relies on your eyes, your ears, and your sense of touch. So we want to take out each one of those systems to see how much someone has, how much sway they have. In a concussion, a lot of kids will end up with what's called dizziness, or they'll have some sort of what's called vestibular symptoms. Vestibular means inner ear, and it really messes with their balance or their dizziness. And so the 3rd condition is standing on a foam pad, and the 4th condition really looks at the inner ear, and are these kids able to stand on a foam pad with their eyes closed without falling over? And many kids with concussions end up falling over, is significantly impaired. And you wouldn't want to send your kid back out on that football field if their balance was still impaired. What's really nice about it is it shows all of the conditions there. It has a graph that ends up, how impaired am I? 0% impaired compared to other kids my age on the firm surface. With my eyes closed, I might be 17% impaired. And then the last one I really messed up, but that was 100% impaired. Obviously, I'm not that bad. But what it would do is it would allow us to have a baseline, because as Julie said, every kid might have a little coordination problem or something like that. So this would allow us to really look at them before a concussion would occur and have some good information after a concussion to be a little bit more objective in deciding if they are back to their normal baseline. So if a concussion occurs, what would be my next step? If you had the baseline testing or the baseline screen, your next step would be to, if it's okay with your physician, to go ahead and contact us so that we can then repeat that baseline screening. And again, that would be included in that $25 fee. You wouldn't have to pay that again. We do advocate that once a year, though, the baseline screening needs to be repeated, because when we're young, our brains are constantly evolving, and what we're finding out is a lot of this research is being done on the college athlete and the high school athlete. There's not as much on the middle school athlete right now, but their brains are constantly changing. And so when we say that it's about 7 to 10 days to maybe get back to baseline, middle schoolers can be actually up to 30 days because their brains are so immature that it takes them a lot longer to recover. As Dr. Connolly said, 90% of the kids tend to recover within the 7 to 10 day period of time. But as I was just saying, the college age average days to recover is about 7. High school average days to recover is 10 to 14. And the middle school age, as of right now, with the research, we're kind of anticipating that it's greater than 14 days, up to 30 days to fully recover. The latest research is supporting this active rehab. So instead of cocooning, like Dr. Connolly said, complete brain shutdown, we do still advocate rest for at least the first 3 days, but after the 3rd day, you want to start to gradually get back into your schooling, and like he said, not maybe doing all those full tests. I do have for schools, if schools are interested, it's called a Brain Step program that will help the administration and the schools gradually help your kid return back to their full cognitive function of a school day. So that's something that's helpful too, that probably in the beginning stages, if you've never been dealing with this, most schools don't have those Brain Step programs, and so there's very little knowledge on that. And so when you're a kid that is used to scoring 110% and now you're scoring maybe an 85 or 90, in the teacher's mind you're still doing great, but that's not what the kid is used to. So you really have to get that kid back to its normal 110 or 20% of what they're used to working at. So if my symptoms do not resolve, so this is at that, maybe that 14 to 21 day period of time, if your symptoms don't resolve, we may recommend some physical therapy, because lots of times at this point, those kids will manifest into one of these 6 categories. They'll either continue to have cognitive problems where they have like a lot of headaches, or they're very tired. Vestibular is more the dizziness or foggy-headed feeling or balance problems. Ocular, where they have problems with their vision, that often goes hand in hand with the vestibular, so we can work some exercises for that. The anxiety or mood, that's more with the physician with some medication possibly. Cervical problems, so the cervical neck pain, so we're finding out a lot more of information on how to help with those particular problems. And then of course these migraines can often be an issue as well. I talked about this Brain Steps program, so I have some of that information as well up here. How do you get to physical therapy? What you would need is a referral from your physician, and that would then be processed through your insurance company. But you would need a referral from the physician that said for physical therapy for an evaluation and treatment. That evaluation is approximately an hour and a half long. We have learned that there's a lot of testing that we can do to really look at the different systems. A lot of these kids have a lot of problems as soon as they get their heart rate up, that's when their symptoms start to come back. And so we're able to then guide the athletic trainers if they're at the high school level, we're able to help guide the athletic trainers into this what's called a 5-step program. They gradually go until the 6th step is returning back to full play without any problems. If they're in the middle school, that's where Julie and I would come into play, where we would be able to help guide that 6-step program till they're maybe basically ready to go back to play for the physician to clear them to go back into play.
Dr. Olivero came in, and I thought maybe you wanted to talk about from a pediatrician's standpoint.
Yeah, from from a pediatrics point of view, it's our point of view. It's a little bit different than an adult. So an adult, they've already reached their intellectual maturity, or we presume that they have. But a child, on the other hand, every single day, they're given more and more tasks in school. So they're being challenged every single day in order to grow, to develop and get into their developmental potential. What we want is for that child to reach that developmental potential. So if you're in 5th grade, we expect you to actually graduate high school. So if you have an insult sometime in the 5th grade, sometime in the 6th grade, where you're now stopped, basically, this insult caused your brain to stop growing, stop maturing, stop developing, you're going to have a very difficult life. Literally, your entire life as an adult is already wiped out just because you bumped your head. So just last week, actually, there's a group of pediatric neurologists, I just found out, in Colorado. They put together basically what you're seeing here. They put together a whole package of concussion guidelines that are currently is at the CDC undergoing review. And it's basically what we're discussing here. What to do when a child has a concussion because of all the consequences that can occur. So it's just to summarize just what's been iterated or what's been said already. The first thing we do is take them out of the play. We don't want them to continue getting more and more bangs in the head where things are just going to get worse. We want to reduce the amount of neurocognitive demands also without taking them completely out of school, which leads to the teams that are involved. So we need the family team, we need the academic team, we need the coaching team, and we need the medical team. So and everyone needs to be in sync to get your child to reach their developmental potential. And that leads to the education. So we're starting the education. We need to educate everyone to understand what the consequences could be if we don't take action. What do we do when there is a concussion? We take the child out temporarily, maybe one day, and then slowly get them back into basically where they were pre-concussion. We ask the teachers and coaches to adjust and accommodate the child so that they can get back to actually using their brain the way it was prior to the hit, and we pace their we basically pace their intellectual demands. The baseline testing is very, very important because as a physician, I want to get the child back to where they were prior to the insult, but I need to know what that was so that I can get going. So if I have a child who had a concussion and he's not speaking, where was he before? Was he an autistic child having difficulty speaking? Then I have to manage it differently as opposed to a child who was set on going to law school, and at the 6th grade he was already at a collegiate level, but now he's speaking at a 6th grade level. Everyone would say, oh, he's normal, but no, he was very, very advanced. We just wiped away a good 10 years of articulation, which we wouldn't even know about unless we have that baseline. And that's really, really where pediatrics is. It's our focus is really getting your child, to reach their developmental potential.
I have on here those Zurich guidelines that Dr. Connolly was kind of talking a little bit about too, with returning to play. So I'll find them on here.
Any other questions? Yes.
For the long-term symptoms, you talked about physical therapy, and I know for athletes and for young people, that's what your goal is. But what about when you have long-term post-concussive?
We see in our practice here at EVAN, we have seen people as old as in their 70s that have had a fall with a concussion or had a work injury, and they're trying to get back to work. And all of it comes back into those 6 subsets of the vestibular, cognitive, ocular. So really anyone of any age will benefit from physical therapy, whether it's an athlete or someone in the workforce.
Because I've been going to my doctor in another area, and Workman's Comp is encouraging me to do something more like this, but I haven't been able. They sent me to a neurologist, and she said, no, just keep resting like you've been, and keep adding more to your plate, and I'm not nearly back to the schedule I had. And
Sometimes it's just getting out there and educating everyone and being an advocate for yourself.
That's what
because unfortunately, even the Zurich guidelines, they meet, I think, every 3 years, 4 years.
I think the concussion thing is every 5. Like
Yeah. And they're constantly, the guidelines are constantly changing. There's new research out there.
So should somebody like myself just, after this, talk to you and sign up?
Well, yeah, that's where you
I'm
can
gonna
talk to your physician and say, and then, if it's just the cognitive stuff, sometimes it's as little as us giving you some advice on what brain games to play. There's just brain games that you can play on your iPod or iPad, Sometimes it's just a matter of understanding it and understanding the whole concussion thing and knowing that it's kind of a process. But you got to push the system a little bit if you want it to get better. If you have symptoms with exercise, then the standard for us would be to use heart rate, and we keep increasing your activity level at a certain heart rate, and every week we may say, we want you to go now 5 beats above that heart rate, to eventually get you back in. If it's more balance or vestibular or dizzy type stuff, we look at what's causing some of those issues and then design an exercise program that would fit those particular areas of deficit. If it's cognitive, it's more like the brain games that oftentimes our occupational therapist has. We have good, a team approach here that we talk to the speech therapist or the occupational therapist to get some of that advice.
I guess like Janine said, no concussion is the same, so you can't compare yourself to anyone else, which is why when you come in for therapy, we have an hour and a half to try to figure out what your symptoms are and where your deficits are so that we can individualize a treatment for you.
I think that's the biggest frustration too, is because you a lot of people are referred to the neurologist, and correct me if I'm wrong, but most of the time the neurologist is like, well, just go follow with your PCP because there's nothing wrong there from a structural standpoint. So they're just kind of not sure what to do with you.
Yeah.
Yes?
Yeah, the 10% that don't recover within the 7 to 9 days or 14 days, whatever, is there a sense about why that is? With that 10%, what goes on with them?
For pediatrics or adult?
For any.
From pediatrics, based on the conference that occurred last week, with the newest information that they had, what they were finding out is that there's very small amount, or this is the theory, there's a very small amount of swelling that's going on. And they used a machine, I can't remember, what was it? Can't remember the machine they used to detect this, some special CT scan that was detecting the abnormalities in shifts of like the glucose and electrolytes. But basically there was just a tiny amount of swelling that actually compressed a little bit on the nerves, the neurons, which is actually what can give you the very small amount of compression can give you a disturbance in your balance, can give you a very small disturbance even in your vision, which can cause a little that blurry vision. But at this point, that's the prevailing theory, and they're not sure if it's 100%, but that's the prevailing theory that the evidence is going at. And which is why it's more important not to keep using and putting more demands on the brain, because the more demands you put on it, the more the action potentials have to continue. So every time you're thinking, you have to basically shift electrolytes back and forth inside and outside cells, and that causes shift of water inside and outside cells. So you have this kind of ballooning coming back kind of thing. So you want to kind of minimize that as much as you can.
And I think the other thing that they're finding is they're doing a lot of this research, like he said, with what's called biomarkers. And those biomarkers, depending on what kind of biomarkers are, like they're finding that a certain biomarker will tell people or tell the physician that this is going to take a lot longer. But that's extremely expensive, and that's how they're doing a lot of this research now. So it's just, there could be more damage to your axons, as he was saying, and those neurotransmitters than somebody else.
I just read something with females, that females are, in the research, they're taking longer because we have weaker neck muscles. So you have more of that deceleration, acceleration. So unfortunately, just not having the strong neck of a female compared to a male is taking a longer time.
Look at those thick, ape-like foreheads, too.
Yes, I think so.
Yes.
How about age? I'm sure I'm the oldest person in this room, and my fall was the end of December, and I'm still suffering.
Mine's January.
There's something to be said for that in the older brain. So as you age, your brain shrinks a little bit. It just kind of atrophies. So there's both good aspects and bad aspects about that. The bad aspect is being that if you imagine your skull is like a helmet around the brain in its own, so you now have a smaller brain with a looser fitting helmet. So there's more room essentially for the brain to slosh, so to speak. So you may get more injury, and you may be more prone to these they're called crew and counter crew injuries. So you bounce on the front, then you swing back the other way and bounce on the back. So I think elderly patients are more prone to having more severe injury, definitely more true traumatic brain injury, because there is more movement of the brain. You're more likely to tear blood vessels. You're more likely to have bleeding associated with it, and that's where the symptoms kind of come from. That's why we will always scan elderly people who come in and hit their heads, because the unlike children, the elderly people just have such a higher incidence of having those kind of dangerous findings, those dangerous outcomes from head injury.
Well, today Janine explained to me when I play bridge, I play a lot of bridge, how I get these terrible headaches. But I played bridge this afternoon, and when I come home, all I want to do is sit down and I'm out, like I'm sedated. I just go to sleep. And this is happening to me all the time, and I'm getting a little depressed.
Yeah, and that's where I think we talked about you should continue to play bridge, but maybe instead of playing for 3 hours, we should start with 1 hour and kind of work your way up.
Yeah.
So when you talked about not stressing your brain during that time, but then there's at some point, like you add stressors, and so even for youth, you would add homework, you would add,
Yes.
read a little bit, right?
Yes.
And it's just still a challenge.
Well, I'm concerned about my memory.
Yeah,
I
and
don't know
like
if it's
these,
gonna come back or not.
right, and that, nobody, I don't think, like you said, an older brain, you could have some permanent damage there that no matter how much we try, you're gonna have some damage there, some permanent damage.
The younger brain too, I mean, they say, you don't develop new brain cells, but the younger brains are more elastic. You can not necessarily develop new brain cells, but you can form new connections and kind of, it's a more plastic, a more moldable younger brain. And the elder brain just, once those connections are severed, it's exceptionally difficult for them to rewire, so to speak. So any injury is more likely to be a permanent injury.
But on the hopeful side, it can take years, right? So you can keep, no?
Oh, yeah, no,
with
I mean-
for an older person, it could be 2 years and you'll still be improving slowly, like exponentially slowly.
Right.
Okay.
Education, I don't know, I'm a middle school teacher, and we don't have much of a chance to speak with our colleagues during the day in the different subject matters. So when you're talking about gradually bringing back a kid that had a concussion, it's, knowing the teachers I teach with, I know they don't know this. So I think there needs to be a whole nother piece for the teachers in this area, particularly the middle school teachers, so they can communicate with one another about how much homework they're giving the child as a team. Because if one teacher assigns 10 minutes, but every teacher assigns 10 minutes of homework, that child is going to be way over their limitations.
And I think as you guys have known, as you're going through the concussion, is people look at it and they say, oh, but that's not going to happen to my child, or it's not going to happen to me. But until it happens, then that's when you get to the point where it all clicks and you're like, wow, I need to talk to the middle school teachers. I need to talk to this. I need to talk to that. So unfortunately, it's sort of like it's not going to happen, but when it does, that's when you realize how much a concussion can affect your child and your family.
We've learned, sorry Janine.
No.
We learned, Sylvia is on her second year of concussion in June, it'll be 2 years. Brain steps helped us enormously at the beginning. And the other thing is I'm always in contact with teachers. And I think as a parent, that's how you have to be. I mean, you're the advocate for your child. And if you don't, like I'm always emailing a teacher saying, can you please cut back? Could she do this at 2 different times? Or, can she have, and she does, she gets extra time on things. That's the way it has to be. But I think the brain steps is what people need to know about.
I agree with you, and that's where I was kind of going with this too. I think when I went to Philly a couple weeks ago at their conference, there was a lot of teacher administrators there, and you just don't have that around here. So unless somebody that's here from a school can get something started in a school and get those administrators on board that when a concussion occurs, this is the steps we're going to be doing so that the parent isn't doing everything, because that is frustrating.
But what's very frustrating for a parent dealing with concussion,
And
trying
then
to talk
also
to the
teaching
teachers,
everybody.
trying to get, and nobody knows.
But I've also learned around here, people don't want to, it's not going to happen to their child.
Right.
So we don't need to learn about this.
Right.
You know what? We didn't think it was going to happen to her either.
Yeah.
Within seconds, our life changed.
Yeah.
So last week, this new procedure that's in the CDC's hands right now, one of the and I have a copy of it, and I think it's awesome, to be perfectly honest. But one of the things in there, it has a chart, and it has the teams involved, and it does point out and actually specify who in the school, which basically names every single adult in the school, would have to participate in this. But then they also make a requirement that there's a 1-point person that's going to be responsible to make sure that all of the academics, everyone in there, is educated on this. And they all have to report back to that 1-point person. And everyone has to take a yearly refresher. I think it's an awesome program that they're, it's basically everything that we're saying, but just putting it on paper. it's all common sense, but it's just on paper, and it kind of has more authority if it's on paper. And it's at the CDC, so if they put their stamp on it, it's going to be, oh, look, the CDC.
So then everybody will have to do it.
Everyone will have to do it. And actually, one of the things, since 2009, I learned that every single state has a law of concussion for students, including Pennsylvania. And it's the law in Pennsylvania actually requires schools to have some sort of education going on for the teachers. And the point place for them to get their training is in Harrisburg, actually.
Do you know?
I just found this out.
They didn't have an in-service for this area. In Bloomsburg, they had a teacher in service on concussions. You
Well,
didn't-
youth sports, like all the coaches have to, but I don't know
No,
of
this was
anything.
all the teachers, because.
That's great.
One of my friends was filling in for me, and he said, we had this at school, I get that, they're all different.
That's great.
I don't know if that's all you got out of it.
But it's a start.
Yeah.
So is one of your goals to actually get into the schools? Offer this on an in-service day, maybe meet?
I have talked to the Mifflinburg School District, and the football coach has expressed that he was interested. I talked to Shigolini, the football coach. He expressed that in June he would be doing something. He thought, could you come out and just talk to my parents and kind of explain to them what the concussion thing is, and like what you would do with baseline screening, because he said, I'll be honest, I thought the impact test was good enough. You know, so he said that's what most parents are going to say.
Which the impact test is good,
Yeah.
but not, anything, not one test. The more things
It's
that
just
you
a
can
piece of
gather
the
the
puzzle.
information.
Right. And I think the more you educate, if you start that in the system, more people are going to hear about it, and that's going to spread, and it's going to become, people are going to seek that out.
Right. And we have talked to all the local school districts through their athletic directors of our program, of our screens, and so forth. So we have been reaching out
So
to
being a
them.
parent advocate, I know where I go, I will ask that question.
And you should, because it'd be interesting to see if they had that information.
Yes.
Because I purposely went to Mifflinburg to see if they were going to do what I asked them to do, and they did. So that was good. That was at least getting parents to be aware that there's something out there. Yeah, so yeah, definitely ask, because we did. What school district are you?
Midwest.
Midwest. Yeah, I think we contacted them too.
Somebody brought up earlier about youth community sports leagues, I think that's the position I'm in, as well as being a parent. But is there, so for community volunteer run sports organizations, is there an education program that we could have our coaches go through? That would be a standard.
If you'd like one, I'm available.
Okay, thank you.
But that's the best I could say.
Okay.
I don't
I'm
know
not
if any that are available.
I'm not sure what the coaches, you're a coach, what the coaches have to be educated, because all the coaches that I've talked to said, oh yeah, we went through a concussion training.
Like I know for soccer, they
Mine
had.
was through the AYSO
Yeah.
Safe Haven.
And I think the Heads Up program online has one also.
Kristen, do you guys have to go through?
Our coaches have had to go through, but like I'm a parent volunteer, I have not had to go. It depends on what your role is in the
Yeah.
program.
Yeah.
As a youth football and cheerleading league for younger kids.
And see, and you might be good to have like that pointed person, almost like the scat stuff, like doing that like being part of their physical that they have to go through, having that scat, or at least giving the parent the option of doing this $25 screen. That we would do it. Yeah. Parents don't want to pay that, maybe, but some parents will. Yeah.
Can this be done kind of in the middle as well? Like, if you're kind of stable for the moment, but that could change. But if you want to get a baseline for where you are now, since you weren't able to get a baseline before the TBI,
Yeah.
but you're in a good spot right now, could you sign your kid up for something like this?
Oh, absolutely. Yeah, because that would be their new baseline.
Yeah, it's not a baseline, but it's like a baseline for now.
Yeah.
And what the baseline does, it gives us something to compare. So as we make interventions through therapy, schooling, or modifications to schooling, we can go back and retest them to see if there is any improvement.
That's part of what we do as therapists is we do what's called outcome measures, where you have to have some sort of objective data and then provide an intervention. And then 4 or 5 weeks later, we reassess those same measures. If we're not making progress, then we're on the wrong intervention. And then we change things a little bit. And if that doesn't work, then we talk back to the doctor. Put it in their hands.
So just going back to that, they are actually working on other protocols to get baselines as low as 6 months old for this, because some kids can fall just out of anywhere. So that's one of the newer things that I just heard in the grapevine. And that's a real baseline. I mean, 6 months.
Yes. So I have a 6-year-old that's just starting sports and soccer and other activities. At what age do you encourage people to get a baseline?
6 months.
Is that too young? 6 months is not too young?
As soon as possible. As soon as possible. When you're healthy, you do it.
Now, AYSO soccer did have heading and ball all the way through U12. They just started that this year, so that is a big step in the right direction. There's a deceleration of that ball.
There will be other rules out for midget football, such as no contact practice. Like, that's going to be coming, where they will be allowed to practice, but there will be no contact unless you're playing. Then the game, they'll be allowed a certain amount of contact or whatever. So there are some new rules coming out from the NCAA, I believe. I don't think they're out yet, but that was the talk at the conference I was at from the NCAA guy.
Did you mention that you're seeing more visits to the ER with this? Is that just?
I'm not sure if that's actually true. Maybe because I'm on this concussion panel, I've just been paying attention to it more. It feels like I have. And I'm kind of paying attention to who's coming in with what sort of injuries. I know we said helmets don't prevent concussion, but I'll say everyone that I've seen for concussion was not wearing any sort of protective headgear. So I think you're more likely to get a concussion without it, and maybe there's some protective. I imagine the padding must slow that deceleration by some fraction. I've been shocked at the number of youth activities where they're not required to wear helmets. I've seen the past 3 weeks, 3 kids that have fallen off horses in competitions and not had helmets. That was part of the uniform. They all wear cowboy hats. The parents were totally just blew it off. They were not concerned at all. Nope, sorry, this was the dress pageant part. You can't wear a helmet. You have to wear a cowboy hat. So I mean, it is
The
what it
only
is.
thing that worries me about helmets being a coach is I've seen some coaches use that helmet as part of a strategy. For example, football, hit that helmet off the ball type of thing. And I played sports where there wasn't a headgear. I played rugby, and you didn't do that because you had your face. So I'm a little skeptical about the helmets. I'm not a big fan of let's get shoulder pads on and the helmets on and run at each other.
Yeah, there's definitely an argument to be made. If you took the helmets out of football, would it be safer? And yeah, I mean, and there's probably a case to be made for that. I mean, but then you can also say, well, flag football would be even safer too. I mean, I think there's gonna be changes about that in the way, specifically for that sort of put your head on the ball. That was to prevent neck injuries too.
Right.
So I mean, there's lots of different types of injuries, and it's an imperfect sport, and so.
Well, in Sylvia's instance, she had a helmet on. It didn't save her anything, and she only played softball. It wasn't football, it was softball, yeah. So.
Bike riding is the #1 activity associated with concussion in children.
Do you feel like, as a follow-up, do you feel like youth sports are getting more aggressive, that the play is encouraged to be more aggressive, or do you feel like it's in the news because of the research seeing the long-term effects of it, or?
I don't know. I think a lot of it has to do from the NFL. I mean, because that's the #1 sport in the country. So whatever news that generates, people are going to give some credence to. I think that's primarily where this is driven from. And it's hard to say too, I mean, because those guys move at such a different speed and velocity that Pee Wee football does, but that doesn't mean you can't get a severe concussion from Pee Wee football either. Again, it's not necessarily about the speed of the hit, but rather the degree of deceleration rapidly.
Anyone else have any questions or anything to say, Dr. Olivero? Dr. Connolly?
No, I'm good. If anybody wants any sort of concussion programs for kids, I'm always available if there's nothing available out here. I've been in New York before I came here and see 3-4 concussions a day. So it's something that I think we're not seeing enough here. I think we're only seeing the ones where it's very, very overt. But then again, I came from a very dense populated city. So I don't know what the reality actually is.
Okay. Thank you everyone for coming, and we'll stick around if you have any other questions or concerns.